This is a KSL editorial.
KSL believes the recently granted Medicaid waiver will address needed relief among Utah's addicted and homeless populations. It took state leaders more than a year to get the waiver that will allow $100 million in Medicaid services from the federal government for up to 6,000 Utahns living in poverty. Without the money, the state would be hard-pressed to make good on its promise to help these people. There is an abundance of research tying addiction to short-term poverty. Studies show people who fall into drug abuse are less likely to hold on to a job. They also show that when people lose jobs, they are more at risk to fall into drug dependence. The 2008 recession displaced many workers. This may have had some effect on drug use and potentially homelessness. It is a compassionate and humane necessity that the state do what it can to bring those people to a place where they may pursue rehabilitation. State and local leaders have worked hard to tackle the homeless problem and have rightly identified the need to treat drug dependency as a cornerstone of a solution. Those who work with the needy argue that the waiver will offer coverage for only a small part of the population that could use assistance. But the newly granted waiver will nevertheless provide help for those most in need.
This has been a KSL editorial.